Welcome to a session on configuring eCalcs, the integrated health calculators. Let's start off by viewing one of the calculators, the Meld score for liver disease. As we can see, the current patient's chart information, like their most recent lab results for bilirubin and INR, are brought in automatically. That's part of eCalcs. What isn't readily clear is how these values come in. It's actually something that's configured within the application. I'm focused on the creatinine, which is missing. I happen to know this patient does have a creatinine result. Let's go into this patient's chart. As we can see, they do have a recent creatinine result of 0.9. Let's go set that up.
We're now in eCalcs config within TWAdmin. Now bear with me as I quickly configure the creatinine mapping. We'll see these screens a few more times throughout the video demo though. We'll select serum creatinine under Meld score inputs. We see that while there's an L-creatinine result mapped, we don't have the creatinine resultable. Let's search for creatinine. We'll double click on the creatinine and then click Save. Now it's set up.
When we return to the provider view and bring up the Meld score, we'll find that the creatinine from the patient's EHR chart now appears. That was a pretty simple example. We know from other calculators that eCalcs brings in more than just lab results. With the Framingham risk for general cardiovascular disease, we'll see that eCalcs also brings in vital signs and the problem list. Let's take a look. We have the patient's age and sex, lab results like total and Hdl cholesterol, vital signs like the systolic blood pressure. We have an indicator for diabetes brought in from their problems. Their smoking status is a custom query based on problem data. Lastly, the determination of whether a patient is being treated for hypertension is the physician's judgment. Let's take a look at the setup for the Framingham risk calculator. We're back in the eCalcs config within TWAdmin. Let's open the Framingham risk for general cardiovascular disease and view our inputs. Under HDL, we first see the list of available resultables like we did before. On the right, we have the two HDL entries that are mapped. Under systolic blood pressure, we have all 6 of the Allscripts delivered systolic vital sign entries. When we select total cholesterol, we'll see that it's already mapped to the T cholesterol resultable. Let's go to diabetes, which ties in problem list data, where we have a few more options. First, we have a search for the problems from the problem dictionary. When we scroll to the bottom half of the screen, we select the problem statuses to include, along with the appropriate problem views. With labs and vitals, like HDL cholesterol and systolic blood pressure, we pull in the most recent value that's not in an entered in error status. The mapping for problems, however, allows us to look at active problems, past medical history, and so on. There are calculators where we may look at the history of a condition, like the history of hypertension. In addition to the active status, we would add resolved and assumed resolved. And in the problem views, we would also add in past medical history. Now back to the diabetes mapping. We have the list of diabetes problems here. Below, it's set up to look at active problems in the patient's active view. As a reminder, when we get into the mappings for vital signs, problems, and even medications, eCalcs is delivered with the default values. We have worked with the clinicians here at Galen and clinicians at our partner clients to validate the mappings. This makes the implementation of eCalcs that much easier. You know what? I'm going to blank out these values so we can see what's involved in setting up a calculator from scratch. Now that I've removed all the configuration entries, we'll see that the entries for diabetes, for HDL, for the systolic blood pressure, and the total cholesterol are all wiped out. Now let's go into the provider view and see what happens when we bring up the Framingham risk score for general cardiovascular disease for the same patient. The total cholesterol, LDL, systolic blood pressure, diabetes, all those that were showing up before no longer appear. Now let's go back into TWAdmin and reconfigure the calculator. So we'll start with total cholesterol. We'll type in cholesterol, and we'll find that T cholesterol value that we had used earlier. Drag it over, click Save, do the same with systolic blood pressure. Simply search for systolic, and those 6 all scripts delivered systolic blood pressure entries show up. Drag them over, click Save. Move right on to HDL cholesterol. Here we'll search for HDL, find that value, map that right over, and we'll also search for high density, so we can bring up the high density lipoprotein cholesterol entry. Save that. We'll keep on going. We'll now go to diabetes. Here we're just going to search for diabetes. This is going to bring over a lot more entries than we would normally use. We'd review them with our clinicians, make sure we're bringing in the right values that indicate the patient currently has diabetes. But in this case, we're going to bring all those entries over. We just click on the all to the right button, and all those entries show up on the right. We'll scroll down, select our problem statuses, just the active status. Make sure the active problem view is included. We'll click Save.
As I review each of the mappings to ensure the correct values are mapped over, let's remember that it took just 1.5 minutes to set up this calculator. 1.5 minutes to map the problems, labs, and vital signs for a calculator from scratch. And we can't forget that Galen delivers calculators with most values mapped by default. Let's go back to the provider's view to see the mappings in action.
Now when we click on the calculator, the current patient's chart information pulls in automatically. The total cholesterol, HDL cholesterol, those come in. Systolic blood pressure, that's brought in as well. The diabetes, all these are brought in based on the mappings that we just entered. That's how we configure eCalcs to bring in information from the current patient's chart. We go to the eCalcs config screen within TW admin, select the calculator, and set up each mapped value.
eCalcs, bringing health calculators into the EHR.